The University of Johannesburg's program to build capacity for the use of research evidence was established in 2013, and the aim was to support civil servants in both South Africa and Malawi to better use evidence in their decision-making processes, whether it be implementation decisions or decisions at policy level.
So after 3 years of our BCURE program, we have learned not only practical things about planning and budgets and how to go about implementing interventions to increase the use of evidence in decision making. We've also learnt more conceptual things around how you approach the problem. And in doing so, we've developed what we call our spiral, and we've identified 5 important dimensions that we think would be helpful for programs going forwards to consider in their design. The first dimension is around outcomes, what you're trying to achieve in supporting the use of evidence in decision making. And we've realised that decision makers move from awareness of EIDM to capability of how to use evidence in decision making, and then actual evidence use. And they might go around that continuum more than once. It's not just a linear process, but it's a spiral, it's a circular process. The second dimension is around entry points for programs like ours that are trying to support the use of evidence. So people talk about, are you working with individuals? They ask if you're working at an organisational level or an institutional level. And what we've realised is that whilst you might focus on one area in particular, these are actually quite fluid because individuals work within teams and organisations. The starting point can be defined by 2 different parameters. The position of the people you're working with within their own institution, but also their own starting point on that continuum of awareness of EIDM, their capacity and their ability to use evidence. When people talk about the outcome of EIDM, they often look for a policy that is better informed by evidence. That's considered the kind of big goal. But the truth is that there are many incremental shifts that take place. An individual might be more aware of evidence for decision making, they might be better at finding it, there might be a better relationship between an academic department and the government unit. All of these things are important, they all combine to be contributions to the increased use of evidence in decision making. Contextual factors define the nature and significance of each of those incremental shifts that take place around the spiral of evidence use. And when we're thinking about designing interventions to facilitate movement around the cycle, we need more than one approach. We know from our experience that the workshops and mentorships combined to make a difference and support application of learning and use of evidence in decision making. So we propose that no one intervention is sufficient and that programs to support EIDM need to think about a combination of interventions. So we believe that this slightly different way of conceptualising support for EIDM can help us to design better programmes, to think about how to implement them better, and also to think slightly differently about how we evaluate their effectiveness.
The success of the UJ-BCURE program can really be attributed to our team that have expertise and strengths in a variety of different fields. And it can also be attributed to the strength of our relationship with civil servants and their willingness to work with us. We are really excited about what we've achieved over the last 3 years, and it has exceeded all of our expectations. And we're very excited in continuing these partnerships and relationships with civil servants in South Africa, in Malawi and elsewhere in Africa to keep making EIDM a reality.